This UCSD TV program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest programs.
We are the paradoxical ape. Bipedal, naked, large-brained, long the master of fire, tools, and language, but still trying to understand ourselves. Aware that death is inevitable, yet filled with optimism. We grow up slowly. We hand down knowledge. We empathize and deceive. We shape the future from our shared understanding of the past. CARTA brings together experts from diverse disciplines to exchange insights on who we are and how we got here. An exploration made possible by the generosity of humans like you.
It's a special privilege for us at ASU, Arizona State University, to be collaborating for the first time officially with our partners here at CARTA to create a symposium on evolution of medicine. I've actually had the privilege of working with Ajit Varki on several previous ones on medicine, one on the origins of morality, and I must say that all of the efforts you see from all of these different people and the quite extraordinary production values, it's not just pretty, it actually makes the science better, and we can hear each other clearly and talk with each other in wonderful ways. I think it's a wonderful investment, and we thank everyone who's made it possible. This field really, in terms of the new version of it, began about 25 years ago with a question, and it's a simple question we all ask ourselves at times, that is, why didn't natural selection do a better job? You feel that when you're sitting with your back pain and you think it's your back pain, and you go to your doctor and you say, why do I have back pain? But many of us have been asking a different question. The question is, why do almost all of us have back pain? Please, couldn't we have a better job? And in a kind of off joke I make sometimes, we have figured out what women want. We really would like to know, why is the birth canal so narrow? Really? So many things about the body seem as if they could be made better in a way that improved health simply, but for some reason they haven't. And enormous efforts have gone in recent decades to trying to understand this whole different kind of explanation for disease. Not why one person gets sick, not why the mechanism is broken in that person, but why the mechanism is vulnerable to failure in everyone. We're taking a transition from a view of the body from a mechanic's point of view, which is, hey, it's broken, what's broken, let's fix it, to an engineer's point of view of asking instead, who designed this thing? Why isn't it better? Why can't it be made better in the future? You'll hear marvelous examples of that in the next few talks. The last couple of decades, however, have vastly expanded the scope. That question about why bodies aren't better is only one small part of evolutionary medicine, which really includes everything having to do with the basic science of evolutionary biology being applied to medicine and public health, really for the first time. CARTA has been instrumental in helping that transition to happen, and the medical school here, I think, is one of the few where medical students are starting to get a grounding in evolutionary biology of the same kind of grounding that they get in genetics, physiology, biochemistry, and all of the other sciences that are equally useful for medicine. The field is growing very fast. We have the editor of the main journal, Evolution, Medicine, and Public Health, with us here today, Stephen Stearns. Our society, the International Society for Evolution, Medicine, and Public Health, is having its third meeting in Europe this August. There are all kinds of other meetings. I'll show a slide in my talk briefly later about how you can find more information about those. For right now, I just want to emphasize not only how much fun this all is, but how important it is for us to have chances to talk with each other. There will be only a 20-minute break, but we're going to try to get you out on time for that. Do write down your questions. There's no chance for questions between these talks. All the questions will be at the end.